So you want to be a firefighter, a big boy? Well, you might not know this, but about 2/3 of all our calls are for medical emergencies. The most serious medical emergency you can have is a cardiac arrest. Some people call it a heart attack, but a heart attack is not the same thing as a cardiac arrest. A heart attack is when part of your heart stops working, but you're still alive. That's right, if you have a heart attack, you have a pulse and you're still alive. However, if you have a cardiac arrest, your heart stops, you have no pulse, and you're dead. It's important you understand the difference, because if you start CPR on someone with a pulse, you could kill them. CPR stands for cardiopulmonary resuscitation. It's what you do when someone isn't breathing and doesn't have a pulse. After watching this video, I'm going to ask you some questions to make sure you are paying attention. Before I start my description, let me set up the scenario. You respond to a residence for a collapse. When you arrive, you find a male patient who appears to be in his late 60s slumped over on the toilet. His wife tells you that he went to the bathroom after taking Viagra, because he felt chest pain. Now, I'm going to describe how to perform CPR. Start with a scene assessment. This means checking for hazards before entering the house. Ask the patient or his wife what happened. Ask if anyone else is hurt. The next step is the primary survey. First, determine the patient's level of consciousness using the A, V, P, U method. Each letter refers to their level of consciousness. The letter A stands for alert. The letter V stands for verbal. That means they respond to verbal stimuli. The letter P stands for pain. That means they respond to a pain stimulus. The letter U stands for unresponsive. If you are doing CPR, your patient will always be unresponsive. Determine if they have a delicate spine injury. Then check their airway, breathing, and circulation. You can check their airway by doing a head tilt chin lift to open their airway. Then lower your ear to their mouth to listen for breathing while simultaneously looking at the patient's chest to see if it is rising. While you are doing this, check for a carotid pulse. Once you determine the patient is not breathing and has no circulation, start CPR right away. Expose the patient's chest and landmark for compressions between the nipples. Yes, I said nipples. Don't be so immature. Start compressions at a rate of 30 compressions in 2 breaths. Compressions should be about 2 to 3 inches deep at a rate of 100 per minute. Breaths should be enough to make the chest rise a little bit. If your breaths are too forceful, the patient might puke in your face. Most people don't want that. Continue CPR until you are too tired to continue, help arrives, or the patient gets a pulse again. Now, it's my turn to see if you were paying attention. First question, what is the first thing you do when you arrive on scene? Second question, what is the ratio of compressions to breaths? Third question, do you give CPR to someone who has a pulse? Fourth question, how long do you give CPR? Fifth question, a heart attack and a cardiac arrest is the same thing. True or false? Now, before I finish, I want everyone to know that the patient's chances for survival with CPR alone are less than 5%, so it's really important that you call 911 right away. The sooner the patient gets to a hospital, the better. Every minute counts, so don't delay, call right away. Thanks for playing along.